Hello. Hello.
Good evening, sir.
Good evening. Is it audible?
Yes, sir, it is audible, sir. Sir, just 2 minutes. We are waiting for our host to join the session, sir.
Oh,
Hello, Namaste. Myself Kirtana, a Jignasa member. Am I audible?
Yes, Kirtana, you're audible.
Yes, sir. Let's begin the session. Jignasa is a pan-India movement dedicated to creating a unified platform for addressing all the dimensions of Ayush systems. A motto of Jignasa is learn Ayush to practice Ayush. Jignasa Karnataka stands as a pioneering organization among Ayush students in the state, known for its innovative ideas and impactful programs. We have successfully organized a landmark events such as International Conference and National Arogya Fair in 2018 and 2022, and Entra 2023 and Manthanam 2024 in collaboration with Nimans. For homeopathic fraternity, Unnati 2024 was a unique platform dedicated to empowering the homeopathy students. We have actively partnered with the government of Karnataka in Yoga Day celebrations, and our flagship event, Achinta Ayurveda, has emerged as a leading conference in the field of Ayurveda across the state. To promote the traditional cow-based health practices, we have consistently conducted a Panchagava workshops, training students and practitioners in the preparations and benefits of cow-derived products. Reaching out to the undeserved and rural areas has been a priority. We have conducted numerous health camps, awareness programs, and Swarna Bindu Prashana drives aimed to improving children's immunity. In addition, to support the IU students during their academic journey, Jignasa Karnataka has continuously organized online classes, exam preparatory sessions, and career and postgraduate guidance programs, and fostering clarity and confidence among graduates aspiring for higher education and professional excellence in the Ayush domain. In the ancient Indian tradition, knowledge was not merely taught, it was transformed into wisdom through a deep mentorship and real world applications. Young seekers would approach the sages with one burning desire to learn, to grow, and to excel in their chosen path. The timeless, the timelessly Gurukulas didn't just prepare the students for exams, they prepared them for life. Yashasvi Bhava draws inspiration from this sacred tradition, designed especially for the fourth year BHMS and BMS students. It serves as a your modern day Gurukula, as a focused, exam oriented initiative that helps you conquer every subject with confidence and clarity with daily NCSM aligned classes, expert faculty guidance, dedicated doubt solving sessions, and rigorous model paper practices. Yashasvi Bhava ensures you are not just studying, you are mastering. Join us with this transformative path where you will not only prepare and perform, but truly prosperous. Let's journey begins. I would like to introduce our today's speaker, Dr. Bhavati Dved, Associate Professor, Department of Shalakya. I would like to hand over this session over to you, sir.
Hello.
Yes, sir.
Yes. Can we begin? Can we begin with a slide share?
Yes, sir. You can begin, sir.
Is it visible?
Yes, sir. It's visible, sir.
Okay. So good evening, all of you, all dear my students. So this session is mainly for the orientation for your upcoming final exams. Okay. So I think in earlier days you have gone through paper 2. So today we are discussing about the paper 1. Okay. So myself, Dr. Bhava Devate, Associate Professor in Department of Shalakya Tantra, Ayurveda Mahavidyalaya. Okay. So, why exams are the why exam orientation is required? So before this, we need to know this significance. So even though we know so many things, we have learned so many things. So until unless we don't present, our knowledge and understanding will not be known. So to test that, these exam orientations are required. And moreover, uh, everything, many students, the problem is they know, they understand everything better. But until unless they don't write, they are not known that they have read. Okay. So whatever you read, how much ever you read, until unless you don't execute in the paper, you won't be considered. Okay, so this exam writing is also most important aspect. Okay, and how you present, so how you present, the accessibility to the examiner, how much it is readable, how much it is appealing, all these matters. And most of the times the examiner expects it should be an Ayurvedic orientation. How the stuff he has organized in his answer is noticed by the examiner. So for all those aspects we need to get orientation for this aspect. So hope you have prepared for your exams till now. I consider that you have completed your basic reading revision aspect with all the subjects. Okay. So in this session, I will try to give my suggestions or valuable things which will be helpful for. Okay. So before going to specific, we should have a glance over the Netrayoga topics. What are the syllabus points you have? Okay. So first one is Introduction to Shalakya Tantra, where you should know about Shalakya Tantra definition and Shalakya Tantra origin. A brief history, at least you should know about the Acharya Nimi and his story. Okay. Netra Sharira, where you have few Ayurvedic aspects like Patala, Mandala, and Sandhi. And modern aspects, you should know about anatomy and physiology and clinical methods. The most important part is Samanya Netrayoga Nidana, that is Nidana Panchika, Hetu, Purarupa, Samprapti, and basic classification. So that becomes a very basic platform for all of us for the understanding of the Netrayogas. So we have categories. Our syllabus is based on Adhisthana based. So based on that, Sandhigata Rogas, there are 9. That in that, remember, in brackets I have given few important topics in that aspect. So one is dacrocystitis and blepharitis in this context. Coming to Vatmagata Rogas, there are eyelid disorders where important disorders are like stye, chalazion, trachoma, ptosis, lagophthalmos, and eyelashes disorders. And few other opinions like Kukunaka and Utklishtavatma from the Vagbhatas aspect. In Shuklagata Rogas, you can see mainly the main content comes from the Arma. So for which we correlate with the pterygium and other conditions like xerophthalmia, subconjunctival hemorrhage, scleritis and episcleritis. Krishnagata Rogas, they are diseases of the cornea which we are thinking. Savrana Shukla, especially modern aspects we should know about corneal ulcer, corneal opacity, anterior staphyloма and panophthalmitis. Sarvagata Rogas, where the important aspect is conjunctivitis with respect to Abhishanda and glaucoma with respect to Adimantha. Apart from that, uveitis and xerosis. Drishtigata Rogas, here Timira, Kacha, Linganasha, Kafaja, Kapha Vidagdha Drushti, Pitta Vidagdha Drushti, etc. All this. And modern perspective, that should be refractive errors, cataract, night blindness, diabetic retinopathy, hypertensive retinopathy, optic atrophy, ARMT, retinal detachment, etc. Another more core concept of Shalakya Netrayoga is Netra Kriya Kalpas. So basically, 5 Netra Kriya Kalpas. And other 2 headings you can see is Netra Swastha Rakshana Prayas. So what are the preventive measures and all classical aspects which are told in Dinacharya, like Nasya, Anjana, Tarpana, which is for Swastha also. So all those things can be considered under this heading. And last topic is National Program for Control of Blindness. Okay. So those were the basic, just a brief note about the what is our syllabus with respect to Netrayogas. Now coming, let us know about what is our pattern. So Shalakya Tantra paper pattern for you is total 100 marks. We have 3 types of questions. One is long essay, short essay, and short answers. So long essay, there are 10 marks and there are 2 questions. Short essay, there are 5 marks and there are 10 numbers. Short answers, there are 3 marks and there are 10 questions. So this is your basic pattern of the Shalakya paper now. Okay, and nothing, there is no options, all should be attempted. Okay, so this is the Shalakya question pattern. Now, when you observe the question paper pattern, what type of questions we get? Okay, before discussing specific things, we'll know what are the types. See, either in question papers, you can see the questions like describe anatomy or physiology, which is relevant to Netra Sharira. One another important heading is Samanya Netra Roga Nidana, Purva Rupa and Samprapti. Or there may be enumeration or description, enumerate the diseases, enlist the diseases, such questions may be there. And clinical methods like explain the examination of cornea or some instruments or some tests. And more core subject is our diseases. Okay, you can see directly diseases of like Savarna Shukla, Abdurna Shukla, Anyato Vata, Vata Parya, all these direct questions may be there. Sometimes describe Chikitsa. They can expect direct Chikitsa like Kafajalinga Nasha Chikitsa, explain Chikitsa of Puyalasa. So such things also can be, questions can be expected. Next important area, you can see questions from the Kriya Kalpa, like explain Tarpana in detail, explain Puttapaka Vidhi, or explain types of Puttapaka, or Samyak Tarpita Lakshanas. So all this comes under the heading of Kriya Kalpa. Modern diseases or clinical conditions. There may be direct question. What is conjunctivitis? What is trachoma? Explain cataract in detail, or explain pterygium in detail. So such questions can be there. Then you can see the Shastra Karma, like you have Arma Chedana Vidhi or Lekhana Vidhi, explain Lekhana Vidhi, or you can see any Bhedana Vidhi. So you can expect questions like classical Shastra Karma. Simultaneously, you can expect questions from the surgery also, modern surgeries like cataract surgery, or you can expect tarsorrhaphy or trabeculectomy. So all such questions can be direct surgery questions. And formulations. So there may be a unique Ayurvedic Netrakalpas or formulations that also can be asked in the question. And national programs. Okay, so these are just a brief type of questions which you can expect. Okay, so with this basic pattern, we will be seeing different types of questions. Okay, so we are not going in detail about the syllabus. We are seeing what to write and what are the expected questions and what to be content of that questions. So what to write for 10 marks, 5 marks or 3 marks answers. Okay. So we'll see one by one now with these question aspects. Okay. So as we have seen, first basically the topic is with the anatomy and physiology. So I have just added few illustrations based on each type of the questions. Okay, so I'm not going in all detailed types, just from these basic headings I'll be giving one illustrations for you, so that what can be the expected question and what should be our content accordingly. So this is an example where you will get a question like explain Netra Sharira in detail. So this question is basically anatomy aspect, but in question frame there is nothing related to modern. But for 10 marks you are expected to write both Ayurvedic perspective and modern perspective. So remember, for 10 marks, if there is Netra Sharira in detail, you are writing Ayurvedic perspective and modern perspective. What Ayurvedic perspective? There are 3 basic things. One, you should tell about Netra Pramana, Vidyadvangulam Bahulyam. I hope everybody knows those shlokas. I have not quoted anything about the content. I am just giving you sidelines or checklist what you should write in that question. So mainly you will divide into 2 topics. One is Ayurvedic perspective and modern perspective. So in Ayurvedic perspective, Netra Pramana, Panchabhautikatva, and brief about Mandala, Patala and Sandhi. So try, because it is a 10 marks question, try with the explanation with the diagram. So to fetch more marks, the content should be more valuable. See that Mandala, Patala, Sandhi, you will explain with the diagrams. And modern. See, modern anatomy has a vast explanation. So for 10 marks, restrict yourselves to basic eyeball dimensions like its circumference, width, breadth, size, weight, volume, etc. And basic tunics, that is outer fibrous coat, sclera cornea, middle vascular coat. So such things you can write with the help of diagram. Okay. And lastly, appendages. Mention all the appendages like eyelids, conjunctiva, lacrimal apparatus, etc. And for all parts, just give one line description. You no need. See, here 10 marks is there, we need to give more content, true, but you cannot omit anything. Okay, if you keep on explaining about cornea, it will be incomplete. Even though you know more about cornea, try to complete within one line description. Okay, so this is more important, how you are writing the answer. So I hope this will be your framework, how to write your question related to Netra Sharira. Pardon? Any doubt? Hello? Hello? Okay. So this is with the Netra Sharira. So 10 marks you can expect direct Netra Sharira or even Kriya Sharira also, where you need to explain about the basic anatomy of physiology of eye and physiology of vision, where visual pathway becomes a key part of your answer. Okay. Suppose an anatomy question is asked for 5 marks. What you can expect? You can expect describe anatomy of cornea, describe anatomy of lacrimal apparatus, anatomy of eyelids, retina, visual pathway as a physiology part, or vision cycle, or even phototransduction. So you can expect from the anatomy and physiology for 5 marks, like cornea, describe anatomy of lacrimal apparatus, describe anatomy of eyelids, describe anatomy of retina, visual pathway, vision. So what you need to write for 5 marks question? Hello? Hello, is it audible?
Yes, sir, it is audible, sir.
Yeah. So there is some disturbance, I think.
I have muted them, sir.
Audience. Okay. So if you are asked to describe about cornea for 5 marks, what to write? Just basic cornea description, its shape and significance as a refractive media. Try to picturize these layers. So try to picturize the layers, 5 layers of the cornea with the diagram. So that is more core part of your anatomy of cornea. And briefly explain about corneal applied anatomical conditions like corneal ulcer and opacity. So I think this layers and diagrams becomes your core part, your answer for your 5 marks. Okay, and give one line description about Ayurvedic perspective where we can correlate with the Krishna Mandala. That much is sufficient for 5 marks. Okay, so this is just an illustration how to write for 5 marks if you ask the anatomy. Okay, then if for 3 marks, if you get from them anatomy and physiology, one illustration I have taken is brief about tear film. If it is asked for 3 marks, you need to write just what is a tear film, where it lies, and its layers with the diagram. You no need think about how the 3 layers are secreted, how much quantity it is, what are its applied aspects. Those all are not required. Just give say tear film is considered as physiological part, even then it is considered as anatomical structure. It is component of 3 layers. So those 3 layers you have to mention. Okay, that is outer lipid, middle aqueous, and the inner mucin layer. So picturize and finish it off. Okay, so I think these illustrations will make you to think how should be the points for you to write with respect to anatomy or physiology. Okay, so Netra Sharira for 10 marks you can expect this one question directly. If it is for 5 marks, it can be divided into pieces, like it can ask cornea, lacrimal apparatus, eyelids, or retina. For 3 marks, still more smaller structures. You can expect tear film, you can expect conjunctiva, you can expect pupil also. Okay. Now coming to next point, that is about the basic Nidana Panchaka with the Netra Rogas. So this is also one of the favorite question. You will see in most of the exams. Explain the Samanya Nidana, Purva Rupa, Samprapti of Netra Rogas. Okay. I hope everybody is very much familiar with these basic shlokas. Okay. So it's very easy to answer for this question. Write this shloka, explain this shloka. So shloka is a mandatory part for this question. Without shloka, I think 50% of the marks will be lost in this question. So Sushruta reference should be first priority. In Samprapti, you can expect Vagbhata shloka also. It is somewhat more significant, which highlights the role of the Pitta dosha in the Samprapti. So 1, Samanya Netraroga Nidana, you explain with the Sushruta Sloka, Ushnabhitaptasya Jala Pravesha, Purva Rupa, Samprapti. Samprapti you can add opinion about the Vagbhata. And another important point is significance of Abhishyanda. Okay, so Abhishyanda is considered as Nimitta for Prayana, Nimitta for all Netraroga. So that one point also you can add on with this answer. So if it is for 10 marks, this much is expected. I think no modern points are expected in this context. So when the question is clear that Nidana Panchaka of Netraroga, you need not think about modern points here. You can just explain this much is sufficient. Okay. So this same question can be divided for 5 marks. You can expect Samanya Netraroga Nidana or Samanya Samprapti of Netraroga can be expected. So here try to explain bit elaborate the conditions. Like for example in Netraroga Nidana, so Ushnabhitaptasya Jala Praveshat. So there are various Nidanas. Try to apply aspect with the present practical day activities. Okay, Ati Amla Rasa Sevana, excessive consumption of lot of sour items. So just bit explain more with the present day Nidanas. So same shloka, same explanation, but add on with the present practical day examples. Okay, so this is for Netraroga Nidana. So same with the Samprapti also is the expected question for 5 marks. Another set of conditions where enumeration comes. Okay, so when enumeration or types enlist the classifications, so these are types of questions you can expect. So enumerate Sandhigata Roga, explain about Puyalasa in detail. So this is one expected. Enumerate Krishnagata Rogas, explain about Shukla, Savarana Shukla. Enumerate Shuklagata Rogas, explain about Arma in detail. Enumerate Drishtigata Roga, explain about Timira in detail. Such combination of questions is also expected with the enumeration. Okay, so only enumeration for 10 marks is not expected. So enumerate, so basic classification should be well versed by everybody so that this question, see here enumerate Krishnagata Rogas and explain about Sarvana Shukla. So this enumeration will hold almost 2.5 marks for your enlisting. So 7.5 will be for the disease. So here classification has not, it doesn't have equal weightage. It will be 25 to 30% of the weightage. Okay. So correspondingly, one disease from that Gata Roga is asked for explanation. Okay. So these are some presentations for the 10 marks with starting with enumerations. Okay. So in that example, just I have given one example, enumerate Sandhigata Roga and explain about Puyalasa. So what you need to do, just enlist Sandhigata 9 diseases and focus on Puyalasa. So Puyalasa definition. See, always whenever a classical disease is asked, define it with the which Gata Vyadi, which Dosha and Sadhyasa. So for example, Puyalasa. Puyalasa is a Sandhigata, Tridoshaja or Vedana Sadhya Vyadi. So such type of basic definition with 3 points. One is Gata, Dosha and Sadhya Sattva. You can frame and you can write its basic definition of that disease. Then shloka is must. So whenever you see disease name, try to be specific that Shushruta shloka is a mandatory part in that answer. And write answer, description and Chikitsa Sutra. So this is major content. Finish it off fast. Don't elaborate or don't unnecessarily add on Vagbhatas or any other author's opinion. Just finish off this because the other important content is modern aspect that you have to explain dacrocystitis. So dacrocystitis is inflammation of lacrimal sac and its types acute or chronic. Cardinal features you have to explain and go directly for the management. Because here content is Ayurvedic and modern, you need not go off stages of manifestation, pathophysiology, causative factors and all because it will take away your time. So core part you write just definition, types, clinical features, management, both medical and surgical. Brief in a points. What are the surgeries? PCR and DCT, dacrocystorhinostomy and dacrocystorhinostomy. So this is the pattern you should follow for enumerate Gata Roga and explaining disease. So whenever enumeration is there, try to finish it off early and go with the disease. Enumeration only unnecessarily don't keep explaining about the entire Netra Roga classification. That is not required in such questions. Okay. So for 5 marks, you can expect Netra Roga Vargikarana 5 marks, where the entire classification you have to write. Enumerate for 5 marks Vatmagata Rogas. Mentioning 21 with the shloka will fetch you full marks. If no shloka, try to give defining one-line definition of each disease. Chedana Sadhya Vyadis, you can expect enumeration from Sadhya Sadhyata and Lekhana Sadhya Vyadis. Okay, just enumerate, give one-line definition if possible. So 3 marks, wherever the numbers are less, that can be expected for 3 marks. Enumerate Sandhigata Rogas, mention Krishnagata Rogas. So where the disease numbers are less, that you can expect for the 3 marks. Okay. So this is with the context of classification, you can expect the questions. Next comes with the clinical methods. So hope you all have gone through your practicals in your colleges and you have awareness about the clinical examination of the eye. Okay, in that, whenever this general question is asked, that explain in detail about the clinical methods in eye. So you have a lot of content, but what to write will be the question. So what to write? Try to make in this way that you touch all the aspects of the examination of eye clinically. Okay, don't think about lab investigations and all. So here it's a local clinical oriented examination of eye. So basic, I hope everybody know. One is local examination of eye, assessment of vision, and few instrumental based important examination. One is slit lamp examination, fundus examination, pressure checking, and perimetry. Okay, so these should be your broad headings of examination of eye. So local examination of eye, you will write all the structures how you are examining from outward to inwards. So eyebrows, eyelids, conjunctiva, limbus, cornea, pupil. So each structure has to be mentioned. Key points of that structure has to be mentioned. What you are going to examine or what clinical condition you are going to rule out. So that has to be explained in the local examination of eye. Then important part is assessment of vision, where visual acuity is done, especially distant vision and near vision. That is with the Snellen's chart and the near vision chart. And another two important points is color vision with the help of Ishihara's chart and field vision with the confrontation test. So just mentioning and one line description what it is enough. Slit lamp examination, give a brief note what is slit lamp biomicroscopy. It is used for, it's a tool which is helpful for magnification of the anterior segment. Fundus examination, that is for the looking the posterior segment behind the lens. To examine that, we are using this fundus examination either with the direct ophthalmoscopy and indirect ophthalmoscopy. And measuring the intraocular pressure is also important part of the clinical examination. Mention the types. One is OPD level, simple with the fingers, that is digital tonometry, and applanation tonometry tool, and mention about Schuart's tonometry. Perimetry, in OPD level, you are just following confrontation test. You can mention Humphrey's perimetry as another tool used for this. Okay, so just a bird's view should be there for the entire aspect of the examination. So each structure detailing is not required. If you keep detailing, that will be a very long subject. So try to just introduce or explain in 1 or 2 lines about each structures. So this is the content should be with respect to examination. So paragraphic answer is not expected. Point wise answer is expected here. Okay. So same if for 5 marks. So 5 marks you cannot expect examination of eye totally. So if they ask for that, you should brief out still less in this context. Okay. So expected is examination of cornea, examination of eyelids, examination of conjunctiva, retina, describe the visual acuity procedure, or differential diagnosis of red eye is also expected. So here I have taken example of explain examination of cornea in detail. So just brief anatomy of cornea with the diagram show that what is that? It is a part of outer coat and transparent anterior watch glass-like structure. So examination has 2 methods. One is torchlight with the slit lamp. We are examining the cornea. So what all the points you have to examine? 5S, size, shape, surface, sheen, sensitivity, and tell about transparency you have to rule out, and few applied points. So whether there is a corneal edema as a clinical condition, corneal ulcer as a clinical condition, corneal opacity as a clinical condition, corneal vascularization, and is there any foreign body as a clinical condition. Okay, so just touch with the applied aspects of the clinical conditions of the cornea. Okay, so brief anatomy of cornea, methods, 5S, that is size, shape, surface, sheen, sensitivity, transparency. Again, each has detailing explanation. I think it is not required to explain all the tests how you are going to do with the Placido disc test. Just mentioning of Placido disc test is enough. Yeah. Transparency, significance of transparency, and applied conditions. So this should be your content for the examination of the cornea. Okay. So similarly, for 3 marks, you can expect various questions for the examination point of view. So for 3 marks, you can expect red eye, visual acuity, pinhole test, which is part of visual acuity directly asked, Humphrey's perimetry, which is for the scaling and assessment of the field vision, lacrimal syringing, a clinical procedure, both diagnostic and therapeutic, regurgitation test, a very common test which we follow for the patency of the lacrimal sac, slit lamp biomicroscopy, the tool which we use for the examination of the anterior segment, T-bud test, which is an important for the tear breakup time, is for the dryness of the eyes. Placido's disc test is asked directly, which is for the corneal health. Amsler grid test, that is for the distorted vision done in ARMD. Arcus senilis, it's a clinical condition. This is just nothing but the peripheral opacity of the cornea. Hope you all know this. So these all are expected questions in the 3 marks. Pupillary reflexes are expected. Schimmer's test is expected question. These are small content, just you have to explain what it is and for what purpose it has done. RAPD, it is also expected pupillary reflex direct questions. Gonioscopy, especially done for the glaucoma cases. Iris Bombay is also protrusion of the iris. Posterior synechiae, anterior synechiae is expected. That is nothing but the attachment of the iris and the cornea, and iris and the lens is posterior synechiae. Hyphema, hypopion, collection of blood in the anterior chamber, collection of the pus in the anterior chamber. Purkinje images. What are Purkinje images? It has been asked. That is nothing but the images formed over the cornea and the lens. Ishihara's chart. Just we have discussed. Ishihara's chart is a chart used for the assessment of the color vision. So how many plates are there? You go through and you can mention about that. Sheard's tonometer. This is one of the meter used for assessment of the intraocular pressure. Similarly, applanation tonometry, digital tonometry. Many of the students get confused with digital tonometry. Digital tonometry, there is not a tool. It is just the assessment of the IOP with the help of fingers. OCT, optical coherence tomography, fundus photoangiography, ophthalmoscopy, that is direct and indirect. Retinoscope. See, retinoscope, the word defines usually many students get confused. It is nothing related to retina. It is for the calculation or prescribing the lens. This retinoscope is used. So which specs is required, what number is required for the correction of the patient, that is used. Okay, it is not for examination of retina. So don't get confused. If you are confused, go through once. Okay, autorefractometer is the latest module which automatically generates the what power of lens should be prescribed for this patient. Okay, so this is also expected 3 marks questions. So these are few questions you can expect with the 3 marks with the context of examination. Next, coming to disease aspect. Okay, so here I have taken example of Puyalasa. So here first Ayurvedic part you have to explain, that is what is its definition. Basic definition, always try to start with Adhisthana, Dosha and Sadhya Sadhata. Then respective shloka, this is a mandatory part, and description if possible wherever with the diagram. So where is the swelling, where is the Hello. Hello.
Sir, you are not audible.
Hello. Is it audible now?
Yes, sir, it is audible now.
Whether screen is visible, sir?
Yes, sir, your screen is visible. Sir, slide
Oh.
share is not visible.
Now, sir?
No, sir.
Once.
Yes, sir, it's visible now.
Oh. Yes. So I was discussing about the Puyala, sir. So what should be your content? So Ayurvedic part, that is shloka description. Chikitsa Sutra, if shloka is then very good. Otherwise, just explain treatment. And other any references or formulations by Yukti you can mention. And modern you have to give equal weightage here. Explain about the dacrocystitis, its types, and clinical features. And management, just mention about medical management and surgical management. So this should be content of your answer. Okay. So here, ideal structure, what you should think for any Ayurvedic diseases, try to start with the definition. If shloka is a well and good, if any synonyms. Nidana, if there is no specific nidana with respect to the disease, try to take some points from the Samanya Nidana and that dosha specific nidanas you can add on. Samprapti, Samanya Samprapti you can add on. Purva Rupa, if it is there, mention or directly mention about Lakshana. Sadhya Sadhyata, which is told that you need to explain. Chikitsa, try to make a sutra. When you explain sutra, try to make it point wise so that which are the shodhana karmas, which are the shamana karmas, what are the kriya kalpas, or what are the shastra karmas. So try to classify these points. Just paragraphic answer is not required. Just key points with the sutra what you have, which are the shodhana karmas, which are the shamana, which are the local procedures, and shastra. Try to uh, segregate the chikitsa in this pattern. And modern correlation, exact correlation is expected. In some diseases it is not possible. Whichever you feel better, just give a brief definitions, clinical features, and management. When correlating, try to give one line hypothesis why the condition is correlated with such and such conditions. So Puyalasa, why dacrocystitis, so which lakshana or which clinical feature is matching. So that one hypothetical explanation is very well uh, support to explain that disease. So try to give that explanation why you are correlating this disease. Okay, so this should be your content for your general disease answers. So similarly, if the modern disease is asked, try to define types, clinical features, investigations any specific, complications, and management. So in management, classify medical and surgery. So these are general headings or side headings what you should maintain. So content, sometimes it may be less or more, but see that you are answering in this pro forma. Sometimes you may not be able to remember all the things, or you may know very less things, but try to answer in this pattern and show that you know definition, you know clinical features. I don't know about investigations, I know about complications, I know only medical management, I don't know surgery. So try to present in this way so that the examiner will come to know what you know about this disease. So based on that, the marks is expected. So just brief paragraphic answer will not fetch you marks. Okay. So how Ayurvedic diseases, you all know 76. These are few modern conditions which can be expected. So this is my observations with the previous question papers. See, just a dacrocystitis is more expected, refractive errors, stye, blepharitis, diabetic retinopathy, hypertensive retinopathy, ARMD. So these are few 3 marks questions it's expected. Optic atrophy, optic neuritis, anterior uveitis, phthisis bulbi, night blindness, that is retinitis pigmentosa, and subconjunctival hemorrhage. Subconjunctival hemorrhage can be asked for 5 marks also with reference to condition called as asthma. Okay, so these are few question can be directly with this disease. So diabetic retinopathy, there is no exact Ayurvedic classic correlation, so it is not expected any Ayurvedic explanation. You can give your hypothesis with the Prameha Upadrava. Whereas blepharitis, you have correlation. For refractive errors, Timira is expected. So whenever modern disease as a question comes, if it is for 3 marks, write specific to that question disease only. If it is for 5 marks, you try to explain that modern disease and give some content with the correlated Ayurvedic disease also. Okay, so so that was about the diseases. Next comes the Kriya Kalpas. So these are also having equal weightage. So 10 marks you can expect usually Tarpana and Putapaka in detail. Okay, so 10 marks you can expect these two procedures. Nasya Karma is least expected because it is seen in paper 2, and otherwise Anjana Karma is also expected, but very commonly, very frequently you can see only Tarpana and Putapaka. So what should be your content? So first is basic introduction to Kriya Kalpa. Because it is 10 marks, you should give a very good initiation. So introduction to Kriya Kalpas. Among 5 Kriya Kalpas, this Tarpana and Putapaka are important. So what is Tarpana? How the procedure is done? Just one line definition should be given. So that is your first part. Next, indications and main content of that procedure should be Purva Karma, Pradhana and Paschat. So first introduction to Kriya Kalpas. What is Tarpana? Then indications. Then your procedure, how it is conducted, that is Purva, Pradhana and Paschat. And few points with respect to Matra Kala. So you hope you all know that Sandhigata 100. So such Matra Kalas have been explained. So that has to be explained. And lastly, Samyak Yoga Lakshana, Ati Yoga, Ayoga, Mithya Yoga. So all these points have to be there in the 10 marks. Sir, I know only Pradhana Karma, I will explain only Pradhana Karma. And if you leave all this Mithya Yoga, Matra Kala and all means, so that shows that you are not acquainted with the classical. So it will cut off your marks. See that these headings are covered. Okay. So for 5 marks, what they may ask, either directly Putapaka Vidhi, Netra Seka, Ashchotana together they can be asked, Pindi Vidalaka can be asked together, or Anjana Vidhi can be asked together. So apart from that, Samyak Tarpita, Ayoga Lakshana, Atiyoga Lakshana. So all this such combination of two things can be asked. Okay. So remember all this content from the same topics, it is broken down and they can be asked for 5 marks. So always if any procedure is asked, give introduction to the procedure, one major procedure related shloka and description how you are conducting. So for when you ask for 5 marks, this detailing of Matra Kala, Samyak Ati Yoga, Hina Yoga and all are not required. So you can just give an introduction to procedure, shloka with respect to that procedure and description how you are conducting. So this description requires, it should be brief note about this Purva, Pradhana and Paschat. Okay. So apart from this, sometimes such questions is also asked, role of Rakta Mokshana in Nitya or role of Panchakarma in Nitya. So what to write when such question comes? So it's a very vague question. So a very simple structure is uh, always try to compile the things where all in Netarogas Rakta Mokshana are advised. So where all Sira Vedana is advised, where all Jalauka is advised. So you have to enlist those things and you have to explain. So role of Panchakarma, again same things, in which Netarogas, which Panchakarma, like in conditions where Basti is advised, in which conditions Virechana is advised. Or, or sometimes as a basic sutra for Netaroga itself, some Shuddha Deha Shiraso is the basic principle for most of the management of Netaroga. So you can explain the significance of the Panchakarma in management of any Netarogas. Okay. Again, Vamana Virechana Nasya Basti. Something you
Sir, not audible, sir.
hello. Hello. Hello.
Sir.
I think it has disconnected.
Yes, sir. Yes, sir. Now we are able to hear you, sir.
Yes, just let me share. Okay, I think it's visible now.
Yes, sir, it's visible.
Okay. So hope it was not disconnected before this. So we have had a just opinion with the other procedures expected. One is role of Raktamokshana and role of Panchakarma. Okay. So in Panchakarma, explain about 5 irrelevant to any Netraroga diseases which you have known, and Raktamokshana especially Siraveda and Jalokacharna, which you can relate with the different Netraroga diseases. Okay. So these are about the procedure questions expected from the Kriyakalpas and the Panchakarma. So next is modern Shastra Karmas. So you can expect questions from the Shastra Karma. So here I am taking Avmachedana Vidhi. So this hello.
Sir.
Hello.
Yes, sir.
I think that laptop is getting disconnected.
Okay, sir.
I will try to connect with the mobile. Is it visible now?
No, sir, it's
Hello.
not visible, sir.
Screen is not shared.
No, sir, it's not visible, sir.
1 second, sir. 1 second. Hello. Hello. Hello.
Yes, sir. Yes, sir.
Whether screen is shared, Likit?
Yes, sir. It is shared, sir.
Okay. Is it visible now?
Yes, sir. It's visible, sir.
Okay. Okay. So we were discussing about the so Almachedana Vidhi. Audible, Likit? Is it audible now?
Yes, sir. It's audible, sir.
Hello.
Sir, it's
Okay,
audible.
fine. Yes, thank you. So with respect to
Sir,
Shastra
just one
Karmas, we can expect.
interruption. Sir,
Yes. Hello.
sir, can I know how many more minutes the session is there, sir?
I think within 15-20 minutes more.
Oh, okay, sir. Okay, sir.
Okay. So with respect to Chedana Vidhi. So we can expect any Ayurvedic Shastra Karma. So give introduction to Karma. If it is for 10 marks, this is the content. Explain the basic Purva Pradhana and Paschat Karma and Samyak Chinna Lakshana. Even though in question there is no pterygium, you have to explain about the pterygium surgery. Okay, so this is the pattern you should explain Armachira. So it's a very common and expected question for the 10 marks. Okay, so if it is for 5 marks, just give indications Purva, Pradhana Karma and Paschat Karma. So with so you can expect for 10 marks, it is very favorite cataract surgery. So this is a well-versed topic for you all. So give an introduction to what is cataract. So that is basic requirement surgery types, ICC, ECCE, SICS and MICS. Try to explain SICS which is followed and MICS, that is phacoemulsification, in pre-operative, operative and post-operative pattern. So this should be your explanation about especially SICS and MICS. ICCE and ECC is just concept you can explain and explain SICS and MICS with this 3 headings: pre-operative, post-operative and operative and post-operative. Okay. So similarly for other surgeries you can expect, that is for 5 marks or 3 marks, try to define the surgery. What is the surgery? Types and methods if there is anything specific. Main indication for what condition indicated. And brief in 3 headings: pre-operative, operative and post-operative. So other surgeries you can expect is DCR, DCT, tarsography, enucleation, evisceration for 3 marks. Keratoplasty you can expect for 3 marks. LASIK, refractive surgeries you can accept question in an indirect way. Trabeculotomy and peripheral iridectomy. So few which is relevant to glaucoma. So these are also expected for 3 marks questions. Now coming to formulations or yogas. So questions can be from this segment also. So one common favorite is Chandrodayavarti, 5 marks. Give an introduction, what type of medicine it is, its reference, and in what context it has been told. Ingredients, I think Shloka, it's a difficult. Just enlist what are the ingredients and its ratio, preparation method, mode of administration, how it is used, and indications, what in which diseases it is indicated. Okay, so this is a very simple format of any formulations for 5 marks. So similarly, other formulations, what you can expect for 5 marks or 3 marks, Drashti Pradavarti, Gutika Anjana, Pratyanjana. So there are various references in the treatment aspect, Gutika Anjana, Pratyanjana. Sometimes they are formulations, sometimes they are concept of giving Anjanas. So after Anjana, to compensate the complications, Pratyanjana is used. Okay, so don't confuse always with the formulations, they are concepts also. Very favorite formulations and common one is Jivanti Adigrita, Mahatrifla Adigrita, and role of Trifla in Netra Roga. So that is a vast spectrum. It can be asked for 5 marks also. And Saptamruta Loha, one of the common formulations for the Netra Rogas. So it can be expected questions for 5 marks or 3 marks. Then apart from this, other topics, what all you can expect is, you can expect question on the eye banking. So eye banking starts from the eye donation. So how the eye is collected, how it is maintained, and for what conditions it has been used. So these two are interrelated topics, eye banking or eye donation. And Netra Raksha Upaya. So from syllabus point of view, it is expected where you can give classical references with the Dinacharya and what are the ahara which are chakshushya, and also day-to-day practices, how to keep your eyes clean from the modern perspective. In 3 headings, you can explain Netra Raksha Upaya. And National Program for Control of Blindness. This also one question for 5 marks can be asked. So what are the objectives of this? What are the common causes of blindness, in which cataract stands the first? And what are the preventive methods? And what are the treatment modalities which can be applied in primary, secondary, and tertiary levels? So government is carrying out different programs, campaigns, schemes for management of cataract and prevention of glaucoma and all. So all these aspects can be explained in these headings. So National Program for Control of Blindness. Okay. So these are just 10 marks question. There are 2 important questions. Just I am giving a list what you can expect for 10 marks. Probabilities. One is basic, is anatomy is expected. Physiology, entire clinical methods, or full spectrum of Netra Roga Samanya Nidana, Samprapti, classification, all enumeration of all 76 disorders. Or with respect to Sandhigata Roga, Puyalas and acrocystitis. This is also a probable question. And Lekhana Vidhi. It is a common treatment for most of the Vatmakata Rogas. So Lekhana Vidhi procedure can be expected for 10 marks. And specifically Pakshmakopa, Trichiasis, Entropion, and Chikitsa Karma. In Chikitsa, both modern and in Ayurvedic aspect also, epilation concept is explained. So that is expected answer for this. So this also you can expect for 10 marks. Apart from that, Adma Chedana, xerophthalmia, that is role of vitamin A, and WHO classification of vitamin xerophthalmia that you have to expect. You have to explain in this context. In Krishnagata Rogas, corneal ulcer, corneal opacity, keratitis. So with all these headings, you can expect 10 marks question. And general, explain about Netragata, Abhishyanda of Netra. So that is a vast topic. All types and modern conjunctivitis is expected. Explain Adhimanta in detail can be a simple question. You have to explain all types of Adhimanta, and correspondingly glaucoma is expected. In Drishtigata Rogas, you can expect Timida Kachalinganashana altogether description, or refractive errors, or you can expect Kafajalinganasha with respect to that cataract, and classical Kafajalinganasha Shastra Chikitsa, and modern cataract Chikitsa surgery. So all these are expected. So Kafajalinganasha is also one of the favorite question for 10 marks, where you have to explain disease, modern cataract, and classical surgery and modern surgery. In Kriyakalpa, either it is Tarpana, and Putapaka in detail. Okay, so those were the important points aspect what we need to focus. So how to write? Always remember, important is just paragraphic answer is not required. There should be labeled diagrams. Samprapti, a shloka jotege, you need to give a flow chart or a schematic presentation expert. And management also try to give flowcharts, what after the other, one after the other. That protocol try to give in a flowchart format. Okay, so always just paragraphic answer is not important. Diagrams is giving you good visual impact. So the examiner or evaluator will not be reading word by word. So your visual impact gives a satisfaction to the evaluator. So that gives a higher marks. So always try to focus how you can give schematic presentation to particular question, how you can give a diagrams for this answer. So that should be your focus. So always write in a bullet points, start new answer. That's always fixed. Underline the key points, whichever sometimes cardinal features are there. Try to underline it so that the evaluator immediately notices this point. Even though sometimes many points are known, but you are writing in a corner of the paper, it goes unnoticed. So try to underline the key points and maintain neat handwriting. Always handwriting, if it is very poor, how much ever you are intelligent, you are going to lose the marks. Okay. So from evaluator, if I am an examiner, what I expect, see that answer is in point wise, charts are there, schematic presentation. and try to give a language with Sanskrit word. There should be Devanagari Lipi in all answers. Only English quotations, English words is less noticed. So try to put on Sanskrit words, shlokas, references. This gives an value for your content of your answer. So neat diagram should be there, and clinical correlation. Whatever the Ayurvedic is there, what is modern? Whatever modern is there, what Ayurvedic context it is relating. So all these are expected from the evaluators. Okay. The most important is your management of the time in the exam. See, if you see 3 hours, from marks point of view, it's 40 minutes for long essay, 90 minutes for short essay, and last 50 minutes for short notes. Okay, so try to maintain the time management. Sometimes, say 20 marks, it is only 20 marks. How much ever you write, it is 20 marks. So don't spend much time over there. Try to finish in half an hour and go for the short essays. Short essays is the area where you can score much because it is of 50 marks. And short notes, I think probability of scoring higher marks is in short notes. Okay. So long essays, even though you know more, you cannot keep on writing there. Try to finish it off early. Okay. So in a short period now left out, try to memorize the shlokas, practice previous papers. Reading books, stop that reading, start writing. So you yourself make questions. Try to see if this is question for Form X, what should I write? You write it down. So that practice gives you more confidence. And draw the diagrams. For what questions? If Puyala says there, what all diagrams I can put? If cataract comes, what are the schematic presentations I can put? So all these things you can do. If friends, group discussion will boost your information what you have read. Okay. So finally, write with confidence. When confidence is there, your answer will be very rich, and your memory gives you a lot of information. So write confidently. Follow Samhita based structure. So always, whenever you are giving Ayurvedic content, give the references of Samhitas. Give balanced weightage to both the things, Ayurveda and modern. And diagram and clean writing will give you the best impression. Okay. So with this, I conclude my session, and thank you for me giving this opportunity, Jignasa Karnataka, and all the best for all the students for upcoming exams. Thank you. Hello.
Hello.
If anybody interested,
Sir, we extended our sincere appreciation to our esteemed speaker, Dr. Bharat Divate sir, for his valuable time and expertise. Your lectures focusing on the important topics, questions that may repeatedly asked in the university exams, and how to present the answers for 10 marks, 5 marks, 3 marks for both Ayurveda and modern concepts, and also exam strategies. These information have been incredibly beneficial to our students. We are confident that the knowledge and the insights shared will significantly aid them in their upcoming exams. Thank you, sir, for such a valuable knowledge that you had shared with us today. Thank you so much, sir. I thank you to whole Jignasa team for conducting such a valuable and useful session. Thank you everyone for patiently listening, attending these sessions, and making this session successful. Thank you all. Thank you, sir.
Thank you. Thank you.